This is what you need to know. You get the patient in the hospital and you're like, all right, we got to diagnose this patient, right? What is the best initial test in any patient who's coming with a thyroid problem? TSH. Very good. So you'll get TSH, and what's the next one you want to get? Free T4. This is what you need to know. Typically, you will play with TSH and Free T4. Those are the two you get. TSH and Free T4. Initially, if you're going to spill out a lot of Free T4, you'll have elevated Free T4 and decreased TSH. But eventually, it's a hypothyroid state, right? Eventually, you're going to go into a hypothyroid state. You will have reduced level of T4 will be low and your TSH will be elevated. This is your eventual state, but acutely, initially, because you're destroying and spilling everything out, you can have elevated thyroid hormones levels at the beginning. So you get this and you're like, well, I am suspecting that this patient has Hashimoto's thyroiditis. When the patient comes, are the patient going to complain of pain in the neck? No pain, okay? Pain is very unique to one specific condition with the thyroid, okay? So you're not going to have pain. It's going to be painless, right? If you look at the patient's thyroid gland, is it going to be enlarged? But I'm telling you, you're destroying the thyroid gland. Why would it become big if you destroy it? Should you have a goiter with Hashimoto's thyroiditis? But if you're going and destroying it and punching it around all over the place and poking it and stabbing it and all these things, should you have a goiter? Why would you have a goiter if you're having destruction of the gland? Does it make any sense? Inflammation, very good, because whenever you have inflammatory lymphocytic cells going and infiltrating into your thyroid gland, and then it's causing inflammation as well as forming all these germinal centers, right? A lot of inflammatory cells coming into your thyroid gland, right, is going to cause a lot of cell deposition, right? And it's going to cause a lot of inflammation, which means it can cause a goiter first, right? Initially, it will cause a goiter, right? And therefore, you can have an enlargement of your thyroid gland. So expect that despite it being a destructive phenomenon, right? Okay, so you're going to have a goiter in these patients with Hashimoto's thyroiditis. If you get a TSH, we get a Free T4 in your TSH if it is the later stages, right? Because early stage is going to be hyperthyroid, later on will be hypothyroid, right? So your TSH will be elevated, your Free T4 will be low.